I'm Ronnie Rosenthal, and I'm professor of surgery at Yale University School of Medicine. A geriatric surgery verification program is needed because, first of all, as we all know, the population is getting older. And due to medical advances and lifestyle changes, older patients now aren't what older patients were like a century ago. They're actually living longer with multiple comorbid illnesses that would have previously ended their life. And in fact, 20% of all Medicare patients have 5 additional conditions in addition to the surgical disease that brings them for treatment. So taking care of older patients is much more challenging than taking care of younger patients. In addition to which, older patients make decisions differently from younger patients. It's not always about survival and length of life. It's often about quality of life. And so the geriatric surgery verification program aims to help improve the care of geriatric surgical patients with a very formal process that includes setting standards and verifying standards and then creating measures so that we know that standards were implemented in an appropriate way. Any patient who's over the age of 65 will benefit from the program. But also I think the program is designed to help geriatric surgical patients, but we hope that the rising tide will raise all boats and that all geriatric patients will benefit from having hospitals realize and having practitioners realize, nurses and others, how the care of older patients is different. And because surgery is such a focused event, it's a good way to start for us to introduce those concepts. The Coalition for Quality in Geriatric Surgery is just that. It's a coalition of patient and family groups, of surgeons and surgical specialists, of nurses, social workers, physical therapists, occupational therapists, insurers, regulators, and all of the people who are interested in and have some stake in the care of older patients have come together in this coalition to design a program that actually will result in better care for geriatric surgery patients. The coalition consists of patient and family groups, and it also consists of other patient advocate groups like the AARP. It consists of insurers like Aetna is one of our partners, and representatives of hospital systems like the Kaiser Permanente Group is also represented. The goals of the coalition, we basically have 7 goals. And the first goal is to develop a set of standards that are based on evidence where evidence is available, and where evidence isn't available, based on expert opinion consensus. The second goal is to engage stakeholders in the process of developing the standards. It really isn't possible to develop standards that are relevant to patients and their families and caregivers if we don't engage all of the stakeholders. The third goal is to develop measures that actually matter to patients. So unlike the 30-day mortality and morbidity measures, these measures would be more relevant to patients, like return to function, return home, a return to the way they were before they had their surgery. The fourth goal is to develop a verification process that will actually verify that the standards have been implemented in the institutions who have agreed to adopt them. The fifth goal is to develop educational programs, both for practitioners and also for patients and families around the surgical experience. The sixth goal is to pilot the standards in hospitals across the country. The whole project goal is to really be able to expand the project to hospitals of all sizes in all locations. And so we will pilot the standards that we develop, and then with the feedback we get from that pilot, we'll be able to hone the standards to make them more relevant to more hospitals. And the final goal is for us to actually have a geriatric surgery quality summit where we will engage many people in launching this project and then launch it out to the country as a whole. Our goal is to get as many hospitals as possible engaged. And when you have such a big project with so many different moving parts, there's always a chance that it will be difficult to actually, that it'll be difficult to maintain the scope of what we hope to do. But we have a very good infrastructure at the American College of Surgeons and outstanding support from the John A. Hartford Foundation, and a long history of partnership between the two organizations. And so I think that that risk can be pretty well mitigated by the strength of our coalition. We really do think that because everybody's patient population is going to be older patients, more and more people are realizing how important it is to learn how to take care of older patients properly. And I think one of the big drivers for this process has been that more and more surgeons and other medical providers have had experiences with their own older parents or older relatives that have brought to their attention how the system hasn't yet caught up to what we need to do to provide high-quality care. Some of the people who may benefit the most from the geriatric surgery verification program are not just older patients, but older patients' families and their caregivers, and also physicians who care for older patients and nurses who care for older patients, because they will have the support that they have wanted or needed to provide the best care.